Hey everybody, Luke Gordon here with Gordon Physical Therapy, and today's topic is one that I get a lot just from questions from friends, family, and especially patients about what's the difference between physical therapy and chiropractic. So I just want to kind of give you my thoughts on that today, and I'll kind of break it down into three different differences between us as well as some other points I'd like to make about it. Before I get into that though, just in general, I typically advocate for people to consider chiropractic just because I think there's a lot they can offer. So just in case you thought I was going to throw them under the bus, that's not what I plan to do. I do know that at times, PTs and chiropractors can have adversarial relationships, but that's not where I find myself. I just see us doing different things and trying to help people in different ways. So let me just give you that right off the bat. If you were looking for a video bashing chiropractors, this isn't the one, so you can skip it. Or if you're open-minded to this, then just keep listening along. So what's the difference then between PTs and chiropractors? The biggest and most obvious difference is typically just the way we treat patients in terms of the techniques we're going to use. So most of us are going to use hands-on techniques. And commonly for chiropractors, the most common technique they're going to use is a joint manipulation. So they're taking the joint to a certain position and then they're manipulating it. Usually you get the audible popping, cracking sounds. So that's one of their biggest tools in their toolbox. And at least for our physical therapists here at Gordon PT, we're not typically manipulating joints. We'll instead mobilize them. So it's a similar technique, but it's not quite the same thing. Now that will vary from state to state a little bit and from PT to PT, but most of us here at the clinic don't manipulate patients. We just use slightly different hands-on techniques, or we use other techniques to treat things like strain, counter strain, or different types of friction massage, things like that. So that's one of the biggest, most obvious differences is typically we're using slightly different treatment techniques when it comes to the joints themselves. So that's number one. Number two then is how we treat the muscles. A lot of times us PTs, especially here at the clinic, we'll spend a lot of time treating sore muscles with, again, various hands-on techniques, deep tissue massage, trigger point massage, myofascial type techniques. You probably don't need to know those specifically. But so typically our treatment of muscles is going to be slightly different than a chiropractor's treatment of muscles. And depending on your chiropractor and how much time they have with you, they may not focus on your muscles a whole lot. If they do, they have different devices like an activator device. Some of them that I know do active release techniques. So again, it just varies from chiropractor to chiropractor if they're going to spend the time treating your muscles, and if they do, what treatment techniques they're going to use. So again, that's number two, the muscle aspect of things. And the number three is exercise. So the use of exercises in terms of your plan of care, we call it, or your treatment, in terms of getting you stronger and things like that. Now, PTs, that's kind of our background, is exercise-based. Again, clinic to clinic, PT to PT, depends on how you use exercises to get people better. We like to do a lot more hands-on treatment than the average PT clinic, and we do progress exercises as we go along. Chiropractors, again, it's going to vary from practitioner to practitioner, and some of them are going to, put exercises into your treatment plan, and some of them probably aren't. So again, there's going to be some differences there. Again, I think stereotypically you're going to think of us PTs doing more exercise than chiropractors, or just having more of a background. But again, it depends on their training and what their interests are and who they're treating. So that can be a difference too. So those are the main three I see. Again, specific treatment techniques, other ways to treat muscles, and then the use of exercises as part of your treatment plan. But there's three more things I want to mention that are just kind of overarching principles. And the first one, as I've kind of mentioned already, not all PTs are created equally. Not all chiropractors are created equally too. So it's really important to find a good fit for you. Get one who seems to understand what you're trying to accomplish, who can help you the way you want to be helped. And if you don't have that connection, or you just don't feel that practitioner is listening to you, again, whether it's a PT or a chiropractor, if you don't feel like you're getting listened to, then it's okay, in my opinion, to seek a second opinion or just kind of move on. So again, if you're just trying to compare apples to oranges, a PT and a chiropractor, you might want to consider some of those other aspects as well. So that's number one. Number two is that to some extent, a good PT and a good chiropractor really aren't that different. Hopefully we're still using some pretty skilled hands-on techniques to help you with pain management. We're treating your muscles and things as well if we need to, and then we're progressing you to get more active and to do some strengthening. So we're not all that different, at least in terms of our desire to help people get rid of their pain and improve their function and improve their ability to do the things they like to do, especially if you've got a good one of both in both categories. So that's number two. And the third one that I really want to highlight is that in many cases, we actually work quite well together. And like I said at the beginning of the video, I really think there's a lot of value in chiropractic treatment, especially because for me personally, I don't do a lot of manipulation, if any. And so if I have a patient who I think will benefit from both, I am certainly happy, to share that patient and encourage them. Well, hey, if the chiropractor can do some things that I'm not doing and I can do some things that they're not doing, there's a good likelihood that you'll actually get better faster. So I think that's important to consider whenever you're looking for a solution to your problem, is that you don't have to just go with one person, who has a massive ego, who thinks they need to help you specifically. You can use more than one person. You could throw in things like massage therapists and acupuncturists and nutritionists and all these things. In general, people actually benefit from multidisciplinary approach, you might say, just to help them get better faster. So don't overlook that. If you work with a PT or a chiropractor right now, and they kind of badmouth the other one, don't take that for what it is, I guess, and make your own decisions. But it's not uncommon for us to work together with chiropractors, especially for folks who have more complex pain, whether it's chronic pain or it's just more intense from like a car accident. So there's some really good situations where we work hand in hand quite well together. So keep that in mind as well. That's the topic for today, PTs and chiropractors. I imagine if you ask any of your PT friends or chiropractors, you'll get different ideas on that question. So good conversation starter for your parties or something. So anyways, that's what I have for you today. If you have any questions or comments, please let me know. You can leave them below the video if you're watching on YouTube, or if you want to send me an email or something like that, that works too. Thanks for watching. Good luck out there.